Good day. So today, on the occasion of World Thrombosis Day, the three of us, are the vascular surgeons from the Narayana Health Institute of Vascular Sciences. And as vascular surgeons, thrombosis is something that is very, very relevant to what we do, and it's a disease and a challenge most of our patients face. So, firstly, I'll just start with introducing my colleagues. Dr. Prasenjot, he's a consultant vascular and endovascular surgeon. Dr. Rajesh, senior consultant vascular and endovascular surgeon. I'm Dr. Robbie. I'm the head of the department. I'm a vascular and endovascular surgeon. And what do we do? So we are vascular surgeons, so we operate on blood vessels. And what's the job of blood vessels in the body? The job of blood vessels is to allow the blood to flow from the heart to various parts of the body, and then from there back to the heart. So when the blood stops flowing, that is the condition which you call thrombosis or a clot. So Dr. Prasenjot, if you could maybe in simple terms just tell us what is thrombosis, what parts does it affect, how do we deal with it?
So thrombosis, as Sir said, is essentially a blood clot. A blood clot can happen in any part of our body. You've probably heard words like stroke, a heart attack, this thing. So they are essentially manifestations of what a blood clot does. It stops blood flow to a certain organ and causes damage. So the word stroke signifies there's a blood clot that is happening in the blood vessels supplying the brain. So somebody has had a heart attack. He might have it had because there's a blood clot stopping the blood flow to one of the vessels in the heart. Similarly, people have gangrene of their fingers, of their toes because of blood clots that are formed in the blood vessels of their limbs. A blood clot in the blood vessels supplying the intestine can cause gangrene of the intestine, which can lead to abdominal pain, distension, vomiting, and other things like this. So these blood clots can happen in the blood vessels that either get blood from the heart to them, to the various limbs, to the brain, to the stomach, or it can also happen in blood vessels that carry blood back to the heart. So if you get a blood clot that happens in a blood vessel that is carrying blood back to the heart, it's called as a venous thrombosis. And the blood vessels, if the clot happens in blood vessels carrying blood from the heart, it's called an arterial thrombosis. If Dr. Rajesh could speak about venous thrombosis and how it is managed.
So we come across a very common problem. As we are mentioning, the body, you have two systems in the systemic circulation, the venous system and the arterial system. So the venous system, which carries the impure blood from all the peripheries of the body back to the lungs, where it gets purified, and again it is distributed as pure blood for oxygenation to different parts of the body. So the impure blood, that is the deoxygenated blood, which is carried from the lower limbs or from the upper limb, that is the hands, lower leg, and as well as all parts of the body. These are all the venous system. So they are in bluish color, which you can see also, and these are called as veins. So whenever there is a clot in this system, so we call it as a venous thrombosis. The most common, as you all know, is a blood clot in the legs, which is labeled and named as deep vein thrombosis or clot in the veins. So why it is very important? And this can be a very simple problem. It can be manifested as swelling of the legs and pain in the legs, which you notice. This occurs due to three factors. One of the things is called virtuous triad. That is, if there is a stasis in the blood vessels, or if there is any fracture or trauma, otherwise you have any defects in your body itself. That is the propensity of the body itself to clot the blood. These three things will cause clot in the veins. How it is important? First of all, this clot can be very fatal. So it can accumulate as a small clot and become a big clot, and it can dislodge from the leg through the venous system into the lungs. We call it as fatal pulmonary embolism. This can be fatal or non-fatal. If the clot becomes bigger and bigger, and if it is untreated, it doesn't seek any medical attention, and it is not been given any blood thinners, this can lead to fatal pulmonary embolism, and the clots, huge number of clots can accumulate in the lungs and cause sudden cardiac arrest, hypoxia, that is a decreased oxygenation, that is the patient can manifest as a breathlessness. So this is very important to seek early medical attention and treat whenever it's already in the leg, and treat, because most of the DVT, that is deep vein thrombosis, can be treated in a OPD basis, that is outpatient basis, giving blood thinners and anticoagulation, and completely almost cure the problem.
In fact, sir, if I can tell you, I think the fact that you highlighted that this is something that is fatal, but I think it is often missed in our country. Is it not?
Yes. So one of the difficult part of diagnosing a DVT is 70 to 80% of the patients, for people who come with health problems to the hospital, they might have a swelling, but it is asymptomatic. That means they may not have a symptoms. That's why whole world thrombosis is important, because we call it as it is a global burden in the world, so that it is only one hospital preventable death in the hospital. So any patients who are got at high risk, they are admitted in the hospital for any surgery or in the ICU or in the wards, they are at the risk of developing blood clots in the veins. So physician should have a high index of suspicion. Based upon the high index of suspicion, we have to diagnose the DVT by doing ultrasound or by clinical signs such as pain or swelling in the leg. So now I'll ask my colleague, Dr. Robbie, so once the patient comes to the hospital, how you are going to diagnose DVT, how you are going to have certain tools, like
So I think
that he will
so
mention
essentially
that.
the first thing about DVT or deep vein thrombosis is that you should suspect it. So when do you suspect it? So somebody has got a swelling in only one leg, pain, sometimes it's fever, or like some patients who are admitted to hospital for another condition, they end up getting a DVT because they're sick for a variety of reasons. The other common scenarios when a DVT gets triggered is when you had a long journey, somebody who is on the oral contraceptive pill, that is, the birth control pills, somebody who's had any kind of major surgery, an active infection, an active cancer. The commonest surgeries associated with clotting are surgeries on the knee and the hip, and surgery on the uterus, the ovaries, so women's surgeries. So in these situations, if you get swelling of the legs, that is a warning sign that there might be a DVT. Now, fortunately today, diagnosis of a DVT can be done with a quite straightforward fashion with an ultrasound scan, what's called a duplex Doppler, in which we look at the actual blood vessel and we're actually able to see the blood clot in it. And if you're able to identify a blood clot in it, we need to identify what all areas are involved. Is the clotting just below the knee? Is the clotting in the blood vessels between the knee and the thigh? Do the clots go higher up? Do the clots involve the main channels that go back to the heart? Has the clot gone to the heart? All of these things are things that your vascular surgeon or treating physician will want to assess. Once they do that, they will also assess to see what impact this clot has had on you. And they would want to see how your fitness is for treating this. Once that's done, there is a variety of ways you can treat this. As mentioned earlier, today, fortunately, the management of DVT, especially for the smaller ones, can be done with fairly simple course of tablets given on an outpatient basis. There certainly are some patients who need to be admitted to hospital, who need to be monitored, who might require more aggressive treatments in the ways of trying to extract the clot and maybe to use some special methods to prevent the clot going up to the heart. So Dr. Prasenjot, can you maybe just touch upon what are these more advanced methods that are used for management of DVTs?
So amongst the advanced methods of DVT management include thrombolysis. Now thrombolysis as if you can make out from, so thrombus is the clot and lysis means breaking the clot. So in this technique, we use special drugs, which are very powerful drugs to burst out the clots from your blood vessels. Now these are essentially minimally invasive techniques, which involve us putting a small needle into the blood vessel in which has the clot, and we introduce a plastic tube through which we will put medicine and we will try to dissolve the clots. Procedure involves a day of stay or maybe a couple of days depending on how much clot load a patient has. Once the clot is dissolved, we will always check how much of the clot has gone off under a C-arm guidance in a cath lab, and if it is to the satisfaction, the patient is discharged. This does not involve any major hospital stay, and typically within 48 hours, the patient is back home. In some cases, along with this clot bursting medicine, we also use a variety of balloons and other devices to actually suck out the clot from the blood vessels. Now, as Dr. Robbie had mentioned earlier, there can be a variety of reasons why you get a clot. Amongst the various reasons why you get a DVT or a clot in your veins could be a narrowing in your veins, which actually does not allow the blood to flow across back to your heart. If during the process of this clot busting or thrombolysis, we do come across such a thing, we can always do a angioplasty, which means we inflate a balloon into the narrow portion of your blood vessel and widen it across so that the blood can flow across smoothly. On occasion, some patients have a very tight narrowing, which does not expand on using a balloon. In such select scenarios, we do use stents, which is essentially like a metal spring that is deployed inside your blood vessel to keep it open.
Dr. Prasenjot, can I ask you one thing here? So, do all patients who have a DVT require treatments like thrombolysis, angioplasty, stenting, filter, all of those things? Or, where would you choose to use this? How common would it be that we would need to do all of this?
Essentially, maximum, and I think I would say probably 80 to 90% of the patients having DVT do not require any of these interventions. So select patients who are having a gross amount of swelling with the leg being very tight, when we are actually worried that you might end up having gangrene, is the select scenarios when we would go in and advise thrombolysis and would advise the stenting or angioplasty depending on your results post thrombolysis. So there's a very select group of patients who require these interventions. The majority can be maintained with simple tablets and nothing more.
Yeah, I think this message is actually very important to understand, that yes, DVT does happen. Yes, DVT can be fatal, but it's also important to remember not every patient is going to have a bad outcome. A lot of DVT can be managed on a home basis, can be managed quite comfortably. And yes, if you have an aggressive DVT, if you have problems, we have the tools to take care of it. But the tools, like every other tool, has to be used judiciously, and that is where the advice of your physician really comes in, helpful to make that judgment as to, are you somebody who will benefit from a more aggressive form of treatment, or do you require the more simple kind of treatment? So Dr. Rajesh, can I ask you, so we've talked about the treatment. Can you give us some tips about how to prevent getting a DVT? The best prevention is better than cure. So something that maybe you could suggest for that?
So one of the most important thing for prevention of DVT is now in this era is, we call it as the ambulatory DVT treatment, and prevention is the best. So how do you prevent DVT? The most important is you should be always mobile. That is, if most of the patients who get admitted in the hospital for any other procedure like a major surgery, immediately the patient should start walking on the first day of their post-surgery. If they are not able to walk, and we should use other modality, like we get what is called as a compression device, and that will make the exercises of the foot. And also we involve a physiotherapist to come and do exercises. So this passively helps the blood to move in the legs towards the lungs, so that there is no stasis or clots in the leg. These are all the small tips you have to do it. And whenever the patient gets admitted in the hospital and for a surgery, post-op day 1 to that time we use a special kind of cloth, that is, we call it as a stockings, that we apply it on the bed on the post-operative day, first day. That also gives a pressure, applies a pressure of 18 to 20 or 22, that is grade 1 stockings, that is thromboembolic prevention of DVT. So these stockings passively compress and helps in facilitation of movement of blood towards the lungs, so that will prevent DVT. So these are very important steps you take, and most importantly, I would like to emphasize again, mobilization is the key. So more you walk, it's better for the patient.
So,
And
I mean, perhaps I'll just add a couple of things. So,
Yes.
Dr. Rajesh is, certainly the problem of in-hospital DVT is a huge problem. And, as doctors, as surgeons, we're really focused on trying to minimize the morbidity due to that. But DVT also happens out at home in the community. So what are the things you can do to reduce your risk of DVT? Like Dr. Rajesh said, stay active, stay mobile, keep walking. Second thing is avoid dehydration. So if you are having vomiting, diarrhea, having a fever, you are in bed, not feeling well, not walking very much, make sure you drink plenty of fluids. Third, and this is one thing that happens when people are flying, long flight, flying from India to the US or a long flight, you are at risk of getting a clot in your legs. So make sure you drink plenty of fluids, make sure you get up and walk up and down when you can. The same thing applies for a long train journey, a long bus journey. Take a break, and if you can't take a break and take a walk, at least make it a point to move your ankles up and down. So this muscle, the muscle of the calf of your leg, is what we call your second heart. You get it to work, you get it to move, it stops the stasis, the collection, the pooling of blood that Dr. Rajesh was talking about, that predisposes you to a clot. So there are lots of things you can do to help yourself. There are things that we can do to help you, simple things, complex things. But the best thing to do is to prevent a thrombosis. The second best thing to do is to be aware that a thrombosis can happen, what the signs and symptoms are. And the third best thing is to seek treatment and advice early. Thank you, and all the best.